Gracias.
Okay, good afternoon. How are you doing? However you feel, you might feel better knowing that I have 12 hours difference with my country. So if it's 5 in the afternoon, for me it's 5 in the morning, but I am so happy to be here. The title of this presentation was supposed to be People Living with HIV Empowerment for Effective Action, but I decided to change it with this title because then I was reflecting on the session. And I am so glad I did that because now listening to previous speakers, I see that I did the right thing. So I'm going to tell you about some examples of what worked in Bolivia. Bolivia is a small country in South America, on joint advocacy between people living with HIV, women, and key populations, and even other groups that are not named key populations or are not living with HIV. Okay, so.
The arrow.
Okay. Yeah. So it is very clear that on the AIDS movement, we want a movement that will sustain what we want, which is end the AIDS epidemic. But then we keep talking about how specific our population is. You know, and being an activist for 13 years, I've heard, you know, networks of young people living with HIV, networks of people who are older, of 45 living with HIV, and female sex workers and male sex workers. And I think this specificity is okay, because then we get to make these populations clear. You know, we can see them. But then the more we make this specific, I feel sometimes the greater the risk for being isolated from the rest of the movement. I also saw in my experience that this discourse of my population leads to a very uncomfortable situation in which we have to fight with the other one, you know? So I had to find myself sitting in a UNAIDS board meeting saying, why do we have to invest the money that UNAIDS has, or anyone, first in this group and not in my population? And also this happened at country level, because the money is not enough for all the needs we have. So probably we have not been very clever on delivering this message. It is okay to show the specificities of our population, but we also have to keep the links with the entire movement. I think the money discussion, who gets the money first, is the most uncomfortable one, because then we have to fight for who is the owner of vulnerability. Who is the most vulnerable on the AIDS epidemic? Is it the orphans? Is it the transgender women? Is it the women who are pregnant and living with HIV? Is the sex workers? Is the orphans? Is people with disabilities, the prisoners, the drug users? So you will see that if we analyze the concept of vulnerability, actually, we cannot rate vulnerability and say we are rating 10 and the others are rating 4, therefore we need the money first. We need some discourse that is more equitable. And probably we need to go back to some of the concepts that we know started this movement: human rights, justice, the right to health, and gender-based violence. And I'm going to present you some examples of what worked with us in Bolivia. Okay. So these are 3 examples. I'm not going to elaborate a lot on all of them, just to tell you what we did together. Not just people living with HIV, not just women living with HIV, but together with other groups, which included transgender women, sex workers, gay men, lesbian women, and even other people who are not usually connected to the AIDS movement. The first one was the study on gender-based violence. This was the most important thing we did probably in the last 13 years, because we realized that many of these groups were coming to tell us, and inside their own groupings, that they were experiencing a lot of violence. Then we realized that any of these groups, could be a woman living with HIV, a sex worker, a transgender woman, or could be a nurse, or could be a gay man or a lesbian woman. Your life can be like this before gender-based violence, but then after violence, your life is like this, and then we have to get you back and heal the scars of violence. And this study on violence also helped us reaching other people. Even the faith-based organizations, sometimes they are not very keen to speak about, transgender priorities, condom use, sex workers, but they were willing to help us on issues of violence. The other one is what we did when our country coordination mechanism was evaluated. This just happened last week, and we are currently not eligible for another funding for the Global Fund. And the last one is an initiative that didn't start by us, people living with HIV, but by a doctor who wants to build a movement for the right to health in Bolivia, given that we are going to have elections soon. I just will show you 2 body maps. This is the qualitative study we did. We have many of these. On the left side, you can see a body map made by women living with HIV, in which they are expressing the violence we are experiencing, being the most serious thing, the forced sterilization. And on the right hand, you see a map of the transgender women. They are showing us bleeding because of an anal rape. We made this together with the women living with HIV, the transgender women, and the sex workers. When we started this project, the gay men in Bolivia, our colleagues said, there is no way you will work together. No, the women will not join with the sex workers, and the sex workers will not join with the transgender women. And you know what? That was not true. When we all came as women and left aside for a while our HIV status or our activities or our identity, then we all identified as women. And this was a very good experience, because after that we made a joint advocacy with the local governments. Then, based on that experience, the gay men said, okay, we also want those maps. And that was just last year. That's why this map doesn't have the similar quality than the other maps, because this has not been worked by the designers yet. They are showing here, they also experienced a lot of violence. When they saw our maps, the maps of the women, they said, we also live those experiences. And we told them, and why you never spoke about this? And they said, because we are men. And although we are gay men, we have to be quiet about violence, because men don't speak about violence. So the gay men made these maps expressing the violence they experienced, and the results of this study were also very, very strong. The way they are raped, the way they are rejected by their family members. These words in the map are in Spanish. Probably you cannot read, but behind the legs, it says autopsy of a cadaver of a gay man. And on the upper part, you see a happy face. And they said the stigma of gay men in society is that the gay men are always happy. They are always, smiling. But the reality of that man is that they are suffering inside. That is what they wanted to express in this map. And of course, this is not the only one. And not all of these men are living with HIV. This is a map of the sex workers. They are not living with HIV, but the fact that they are drawing the red ribbon means that they are also very aware of how at risk they are of getting HIV because of the work they have. This is an abortion that happened to a sex worker because the pimp wouldn't let her be pregnant because it's not a good business. And the sex workers told us, nobody cares for our lives. And we thank you, Women Living with HIV, Bolivian network of people living with HIV, for coming to ask us how we feel. Because when we go to the health centers, whatever they do in the health centers, they just give us our card, which is the sanity card, something like that, and then they let us go. But no one spends time with us to discuss what is making us sad. Then we also decided to do the maps with the lesbian women. The lesbian women are not often included in the HIV policies and programs because epidemiologically, it seems like it's not a key population. It's not a very vulnerable group. But then we also realized that it doesn't matter, actually. The fact that they were being living violent situations was probably even more risky than HIV itself, because these women were at risk of dying in the hands of their own family because they were lesbian. This woman, she was forced to have an abortion because she is lesbian, and this is a very experience that is happening a lot in Latin America. Although there is supposed to be more acceptance in this region, that's not the case. The lesbian women, they didn't know they could count on the women living with HIV as allies on us. When we showed them our maps, then they saw we are living the same experiences, and then we became allies. Now, what we learned about this study in terms of how to work together and have a joint advocacy strategy. We just came with the term of women. We forgot about all the specificities for a while. And we realized that there is an issue that was affecting all of us, even the men, which is violence and gender-based violence. I'm so very happy that Gottfried mentioned this. When we started to show these maps, also the feminist movement began to start to get worried about the amount of violence that these groups were experiencing, because the feminist movement is so very strong on issues of violence, but they don't speak about key populations. I think it's just misinformation. And some women in politics who are sitting on the governments in Bolivia, and the local governments, they were also very keen to help us. And we got new allies. Okay. On the Global Fund, we were evaluated by the CCM, by the evaluators, and our CCM was didn't pass the test, and we called for a collective meeting, and then many people came. You can see in this picture transgender women, sex workers, male sex workers, also people living with HIV, and even other people who were concerned about what will happen with the Global Fund project in Bolivia. And then we also made this movement. We are starting this one, the movement for the right to health. This is just a concern some people had, and they told us, you have to come because probably you are the strongest network of patients. Patients with TB are in this picture. Patients with diabetes are in these pictures. Medical students and nurses, and people who are just concerned about a better society. So some suggestions for a healthy partnership is that we realize in these experiences that sometimes we don't know what the others can do because we don't see them as equal as us. And this discourse of nothing for us without us probably is making people go away from our side when actually we need them on our side. And we probably have so many similarities. And one of the things that was a basic thing that we did is just listen and take the first step. We didn't wait for them to invite us. We invited them and just listened. And then we happened to have very good partnerships that work very well. And this is what I wanted to tell you. Thank you very much.